Welcome to The Terrible Take, a daily segment telling Steeler Nation what's on our minds. I'm Melanie Friedlander. On Thursday, the NFL and the NFLPA announced that they are jointly awarding 2 grants in research funding totaling just over $500,000 to independent medical researchers. The funds will be divided to sponsor studies proposed by the American Society of Pain and Neuroscience and Emory University. The grants will fund research to evaluate alternative pain management methods that could benefit NFL players, as well as society at large. The studies will investigate the effects of CBD and non-invasive vagal nerve stimulation on alleviating concussion symptoms and mindfulness-based intervention in sports medicine injuries. They will also look at the potential benefit of CBD in treating post-concussion headaches. This is not the first time the NFL and the NFLPA have sponsored research on cannabis and neurologic methods for alternative treatments for pain. Following their first request for proposals in 2021, the NFL-NFLPA Joint Pain Management Committee awarded a total of $1 million to sponsor 2 different studies on the effects of cannabis on pain and recovery from sports-related injuries in elite athletes. The investigators from University of California, San Diego will be evaluating rugby players since NFL players are prohibited from using CBD. Neither group from last year has published their findings yet. The members of the Pain Management Committee said all the right things, claiming that the health and safety of players is always the highest priority. Dr. Alan Sills, NFL Chief Medical Officer, reinforced their desire to provide the best possible care for players, but also stated the importance that every treatment at their disposal clears the appropriate medical standard for wider use. It's not the first time that Dr. Sills has used that uncertainty as the reason the NFL is holding off on allowing players to use CBD as pain management. On the NFL website, the Pain Management Committee provides 2 separate summaries of alternatives to opioids for long-term pain, one for players and one for medical staff. Both versions list all of the usual remedies: aspirin, NSAIDs, steroids, Tylenol, massage therapy, acupuncture, and even biofeedback. And when it comes to CBD, while worded differently, the message is the same in both versions. They say there is variability in CBD products purchased online, so it's hard to know what is really in these products. Although there are studies proving the effectiveness of cannabis in treating long-term pain and neuropathic pain, the NFL questions the accuracy of these findings based on the sample size in these studies and the length of follow-up, and they require more data to make decisions. The NFL remains concerned about the potential problems related to cannabis use, including addiction, psychiatric disorders such as depression and anxiety, and the possibility of impaired driving. To me, these arguments are flawed. So maybe the studies showing that cannabis is an effective pain treatment have some limitations from a scientific standpoint. We know the dangers of opioid use, but team physicians continue to prescribe them. Isn't that hypocritical? If the owners can approve a rule change recommendation from the competition committee for a year, why not do the same for CBD use? It's great that the league wants to make decisions based on medical data and is paying to sponsor those studies, but it will be a long time before long-term definitive data is available. The NBA just permanently ended testing for marijuana in their recently finalized CBA. It's time for the NFL to do the same. That's my take. You can follow me on Twitter @GirlSurgeon. Check out The Terrible Take every day at 5 p.m. Follow us on SteelersDepot.com and check out The Terrible Podcast with Dave Bryan and Alex Kozora every Monday, Wednesday, and Friday.